So good evening and welcome to the 26th Annual NAMI New Hampshire Conference. Cultivating Hope, Together We Grow. NAMI New Hampshire is a grassroots organization working to improve the quality of life for all by providing support, education, and advocacy for people affected by mental illness and suicide. We're comprised of a network of affiliate chapters and support groups, staff, and volunteers. NAMI New Hampshire provides information, education, and support to all families and communities affected by mental illness and suicide. Through our support and education networks, NAMI New Hampshire provides opportunities for people in a safe and comfortable setting to share each other's pain and promote hope. Together, we are working hard to grow and build a better tomorrow for our loved ones and for ourselves. My name is Michelle Watson. I can pronounce my name. I'm the co-chair and host of this year's conference with other NAMI New Hampshire staff and volunteers who have worked together to create this impactful event. The NAMI New Hampshire conference would not be possible without the amazing contributions of our development team, communications team, and technology team. Tonight's presentation is a Zoom webinar. Questions are entered into the Q&A, and we will do our best to get to all of them. We have turned off the chat and camera and microphone for audience members. Although all of our sessions focus on messages of hope, some people may find some parts of these sessions difficult. If you do, please reach out for support to NAMI New Hampshire's information and resource line, or if you need crisis support, please call or text 988. If you have any difficulties tonight, technical difficulties tonight, or during the day tomorrow, please reach out to Raven at the number on your screen. We would like to express our sincerest gratitude to our sponsors who help make today's conference free of charge. Our Hope sponsor is Johnson & Johnson. We will share a recorded message from Ward Bennett of Johnson & Johnson at the closing session tomorrow afternoon. We'd also like to thank our generous and supportive workshop sponsors, New Hampshire Community Behavioral Health Association, WealthSense Health Plan, and AmeriHealth Caritas, New Hampshire. For those of you that are joining us this evening, you will automatically be entered into a drawing of our signed copy of Dr. Honkier's book, Breakthrough, A Story of Hope, Resilience, and Mental Health Recovery. The winner will be notified later this week. So now I'd like to welcome NAMI New Hampshire's Executive Director, Susan Stearns, who will introduce our keynote speaker.
Thank you, Michelle. And good evening, everyone. It is my pleasure to introduce tonight's keynote presenter, Dr. Ahmed Honkier. Professor Honkier is a consultant psychiatrist, honorary visiting professor at the School of Medicine at Cardiff University, assistant professor of psychiatry at Western University, and professor of academic psychiatry at Carrick Institute for Graduate Studies. Dr. Honkier's research interests include global and Muslim mental health and pioneering and evaluating innovative interventions that reject mental health-related stigma and Islamophobia. He has published widely in these areas. He's also co-edited 4 textbooks on psychiatry and religion with senior members of the American Psychiatric Association. Professor Honkier is the recipient of multiple awards, most notably the 2022 WHO Director General Award for Global Health and the 2025 American Psychiatric Association Patient Advocate Award. Professor Honkier identifies as a survivor and is passionate about empowering, dignifying, and humanizing persons with mental health conditions. He is passionate about broadening access into medical school for folks from lower income backgrounds. In addition, Professor Honkier is author of the book Breakthrough, A Story of Hope, Resilience, and Mental Health Recovery, published in 2024. In his spare time, Dr. Honkier enjoys going for long walks in parks, immersing himself in nature, traveling and drinking coffee in local cafes. He also enjoys cycling, running, and raising funds for charities. In tonight's session, The Wounded Healer, Harnessing the Power of Storytelling to Reject Stigma and humanize persons living with a mental health condition. Professor Hankier will describe the Wounded Healer program, which is an innovative method of teaching that blends the power of the performing arts and storytelling with facts about persons living with mental health conditions. Good evening, Dr. Hankier.
Good evening, Susan. Thank you so much for that incredibly kind introduction. I'm delighted to join you all here in Concord in New Hampshire. It is a magical place, and I'm here with my old friend as well, Corey, and some new friends. And I hope to forge some firm friendships that will last a lifetime. So I'm just going to share my slides, and I'm hoping that you can see them. Oh, is that working? No, not yet. Third time is a charm. Is that what they say? Okay. Not quite. Right. This never happened to me before. Maybe this one here. Ah, voila. No. Oh, we have liftoff. So as you can see, the title of my keynote lecture is Harnessing the Power of Storytelling to Reject Stigma and Humanize Persons Living with a Mental Health Condition. So a story is data with soul. A story is data with soul. And I know, I was about to say I think, but I know that we can engage both the mind and the heart by sharing our stories, and we can contribute to a cultural revolution that empowers and dignifies and humanizes persons living with a mental health condition, because people living with a mental health condition are being dehumanized. And we need to go beyond reducing stigma. We need to reject stigma. So I will be sharing my story with you all. And I think it's a story of hope. And we need more hope in this world. We need more love in this world. We need more peace in this world. We need more humanity in this world. Now more than ever, it seems. So I will provide some background information about the mental health of healthcare professionals and students. And I will define stigma, trace its origins, and describe its far-reaching ramifications. And I will also present some data from a pilot study that I conducted that basically evaluated an anti-stigma program comprised of wounded healers. And I coined this mnemonic with my friend, Professor Andreas Martin at the Yale School of Medicine, EPPE, which stands for Expert by Personal and Professional Experience. So if you're a psychiatrist, then you can be considered an expert by professional experience in a way. But if you're a person living with a mental health condition, then you're an expert by personal experience. So if you're a psychiatrist living with a mental health condition, you can identify as an expert by personal and professional experience, or as a wounded healer. And at 2 o'clock in the morning, I was speaking to Michelle about this, at 2 o'clock in the morning, when I'm on call and I am asked to see a patient in a mental health crisis, and this is in central London in the UK in St. Thomas Hospital in Westminster, I draw more on my personal expertise than I do on my professional expertise. And I can't emphasize enough how beneficial my lived experiences have been and continue to be, because I feel I can have that authentic connection with people who are receiving care from me. And I'll also share and signpost my recovery journey. But I mean, recovery, it's as much of a discovery journey as it is a recovery journey. I think with any type of recovery, there is discovery as well. You discover who you are. I experienced an identity crisis, and when I developed a mental health crisis, and I discovered I did some soul searching, and I discovered who I am, and also who my true friends are. And I will elaborate on that in this presentation. So as I said, I identify as a wounded healer. I'm a consultant psychiatrist, I'm a professor. I'm a mental health care provider, but I'm also a mental health care receiver. I was once a psychiatric patient. I'm a survivor. And there is this perception that doctors should be invincible, but the reality is that we are human beings and we are fallible and we are vulnerable to developing mental health problems like everyone else. And that's nothing to be ashamed about. And I can't emphasize that enough. Repetition is emphasis. And I will be repeating that throughout this keynote presentation. Living with a mental health condition is nothing to be ashamed about. So mental health problems are common, if not overrepresented, in the medical profession. And we know that 400 doctors die by suicide every year in the US alone. 400 doctors die by suicide every year in the US alone. And every death by suicide is a tragedy. To quote John Steinbeck, it's a sorrow that weeping cannot symbolize. Suicide is a sorrow that weeping cannot symbolize. This is a dear friend of mine at the Royal College of Psychiatrists in the UK, and she conducted an investigation into suicide prevention initiatives in the US. She received the Churchill Scholarship, named after the British Prime Minister, Winston Churchill. And I'll quote her verbatim. Not only are medical professionals at higher risk of suicide than the general population, but we also disproportionately suffer from the stigma of seeking help. It's a taboo topic. We don't talk about it, especially in the psychiatric profession. So a survey of over 2,100 female physicians who met the diagnostic criteria for a mental disorder revealed that 50% were reluctant to seek professional help due to fear of exposure to stigmatization. 50% of female physicians living with a mental health condition were reluctant to seek professional help because of fear of exposure to stigmatization. So Goffman defines stigma as a deeply discrediting attribute that reduces the bearer from a whole and usual person to a tainted and discounted one. The individual is thus disqualified from full social acceptance. So it's a deeply discrediting attribute. What is that attribute? It could be mental illness. It could be you identify as neurodivergent. It could be your faith. We know that Islamophobia is a growing problem in the global north, in the West. We know that anti-Semitism is a growing problem in the West. It could be your race. And we know that racism is a major issue. If you are Black in the UK, you are 4 times more likely to be admitted into hospital involuntarily compared to people, those who are not Black. You are more likely to receive a psychiatric diagnosis of schizophrenia. You are more likely to be treated with powerful psychotropic drugs, and you are less likely to receive therapy. So imagine you are a Black person and you are Muslim and you have mental illness and you identify as neurodivergent. That's layer upon layer upon layer upon layer of deeply discrediting attributes. And the term for that in the stigma literature is intersectionality, the quadruple stigma, the quadruple whammy. And unsurprisingly, outcomes in persons who have multiple deeply discrediting attributes are poor, to say the least. And the American Psychiatric Association apologizes for its support of structural racism in psychiatry, apologizes to people of color, Black, Indigenous people of color. In the UK, the acronym we use is BAME, Black and minority ethnic background. So, as I said, this is real. Racism is real in the world and in psychiatry as well. So historically, a stigma was a scar from a burn or cut to the skin of Greek criminals or traitors, and the mutilation was a sign of disgrace, indicating that these people should be avoided and shunned. Stigma still persists today in the attitudes towards people living with a mental health condition. We see a fundamental divide between the manic mind and the asthmatic lung, as if those who live with a mental health condition do so out of their own making. They choose to live with a mental health condition, and as such, they don't deserve the same kind of empathy we would show to a person suffering from another chronic condition like cancer, for example. This is Trisha Goddard, a British television personality diagnosed with breast cancer and depression. She described both experiences as horrible, but with breast cancer, people ran towards her with open arms and hugged her. With depression, people ran away. When she was diagnosed with breast cancer, she was inundated with get well soon cards. But the moment news leaked out that she was admitted onto a psychiatric ward following a nervous breakdown, not a peep, and certainly no cards. You go to the psychiatric wards and you will see that they are bereft of gifts and cards. But go to the general hospital, you'll see balloons and you'll see get well soon cards. This is real. Sir Simon Wessely, actually former president of the Royal College of Psychiatrists, actually conducted a study on this, revealing that gift giving was a lot lower in psychiatric patients compared to patients living with a physical health condition. It's not just anecdotal. So stigma. Stigma is a formidable barrier to mental health care services, and consequently, many people living with a mental health condition continue to suffer in silence despite the availability of effective treatment. To repeat, many people living with a mental health condition continue to suffer in silence despite the availability of effective treatment. If that was physical health, there would be outrage. But because it's mental health, there's a deafening silence. This is Dr. Daksha Empson. She was a loving mother, a devoted wife, a brilliant psychiatrist. She tragically killed herself and her baby daughter, Freya, during a psychotic episode. An independent inquiry into her death concluded she was the victim of stigma in the National Health Service in the UK. Mental health related stigma is rampant in the National Health Service in the UK, and not just in the UK, in health services globally. If there's one take-home message from this keynote lecture, let it be this one. Stigma is killing people. Stigma is killing people. Now is not the time to be quiet. We must do everything in our collective power to combat stigma whenever and wherever we see it. A physician bias has been reported in the literature, whereby healthcare practitioners, especially psychiatrists, tend to have more negative views about the recovery of people with a mental health condition compared to the general population. Stigma is almost like mental illness in the sense that those who suffer from it are often in denial. So I was invited to give a keynote lecture at this university. And following my presentation, the cameraman's assistant, he has no background in mental health. He gravitated towards me and he embraced me and he said, "Thank you for making me feel human." And then I met the head of the Department of Psychiatry. And when I entered his office and when I spoke, his face contorted as if I was about to contaminate him with some ghastly disease. He was disgusted by me. His disgust was palpable. His hostility, I was intimidated. So if I'm in a mental health crisis, am I going to go to this self-proclaimed expert in mental health who likes to isolate himself in the lofty confines of an ivory tower? Or am I going to go to the cameraman's assistant who has no background in mental health? Who's going to dignify me? Who's going to provide me with that sanctuary? Who isn't going to judge me? And just because I live with a mental health condition, it doesn't mean that I'm not a potential source of stigma. We have to be vigilant. Engage in introspection. Identify the stigma and expunge it, exorcise it, get rid of it. That's the challenge. because denial is powerful. Stigma is an umbrella term, and it can be deconstructed into three main components: problems of knowledge, ignorance, problems of attitude, prejudice, and problems of behavior, discrimination. This is important when we want to operationalize stigma, because there are validated psychometric stigma scales in each of those domains. If you want to secure funding, we need data. We need evidence to prove that we have pioneered an innovative anti-stigma intervention that is effective. How do we challenge stigma? There are three broad approaches: through protest, through education, and through contact. And the most effective way of rejecting mental health related stigma in adults is when you make social contact with the person living with a mental health condition. Why? Why? Because when you meet us, you discover we are peace-loving, community-serving, law-abiding citizens, and we have hopes and fears and strengths and dreams like everyone else. You discover we are human beings, and we have human rights. And we have the power to reject mental health-related stigma. We have been silenced for far too long. We have voices. We can speak for ourselves, and we will be heard. At the moment, it's everything about us without us. It should be nothing about us without us. Nothing about us without us. And it's not just my opinion. This is the 2022 Lancet Commission on Ending Stigma and Discrimination in Mental Health. And persons living with a mental health condition, I'm not talking about participation. I'm not talking about involvement in anti-stigma campaigns. I'm talking about leading anti-stigma campaigns. And it's not just social contact. It's not just face-to-face contact. Virtual contact. The people who have joined us today, that's an example of virtual contact. And that can be synchronous, live. And if this is recorded, it becomes asynchronous. Even asynchronous contact with the person living with a mental health condition can reject stigma. And then we can scale this up. If you develop a brief video intervention and post it on TikTok, for example, or YouTube Shorts, and we'll come back to that. Because stigma has evolved. This is the digital age. And how we combat stigma must also evolve. So how do we react to stigma? We can internalize it and develop self-stigma. We can be nonchalant, we don't care. And there's a third group of people who become energized. They have a righteous indignation. They have a fire burning in their bellies and thunder in their hearts to contribute to a cultural revolution. So there he is, Prince Harry. You know, is he popular here in the States? I don't know. He's a naughty boy he's a naughty boy in the naughty boy Prince Harry. We love Prince Harry, don't we? We love Prince Harry. So Bryony Gordon, she has a podcast called Mad World, and she interviewed Prince Harry. And in that podcast, he shared that he is living with a mental health condition since the death of his mother, Princess Diana, who is the true Queen of England. I think all of us can agree. And when the royal revealed that he is living with a mental health condition, mental health charities, I don't know if you've heard of Mind before, it's the largest mental health charity in the UK. They report there was a surge in the number of people contacting their helpline. Like Mind reported there was like a 36% increase. They couldn't keep up, they didn't have the means, they didn't have the capacity to keep up with the demand. But the point is, when you share your story, you reject public stigma. But you don't just reject public stigma, you also reject self-stigma as well, because it's empowering. Sharing can be empowering. It's not for everyone. Far be it from me to impose my approach on anyone. It depends on the individual. And Patrick Corrigan in Chicago developed the Honest, Open, and Proud manual, because it provides you with guidance on if sharing is right for you. What do you share? When do you share? Who do you share? It's a personal choice, but it can be empowering and therapeutic and cathartic. This is, I used to work in New Zealand as a psychiatrist. It's a beautiful country. And I don't know if you know about the All Blacks. I mean, New Zealand's a tiny country, population 5 million. They dominated world rugby. And there's something called the haka. And it's, oh my goodness, it's an experience. It really is something else. And John Kirwan was a winger for the All Blacks. And he's the author of this book called All Blacks Don't Cry, because All Blacks, the perception is that All Blacks shouldn't cry, but All Blacks do cry because they're human beings. And John Kirwan was honest, open, and transparent about living with major depressive disorder. And he collaborated with health ministers in New Zealand. New Zealand are world leaders out rejecting mental health related stigma. The charity is called Like Minds, Like Mine. Like Minds, M-I-N-D-S, Like Mine, M-I-N-E. And this governmental campaign to reject stigma was effective. And he featured prominently in that anti-stigma governmental campaign. Again, further evidence to prove that people living with a mental health condition have the power to reject mental health related stigma. I don't know if you recognize him on the left. His name is Anthony Joshua, and he was the former heavyweight champion of the world. And he lost his belts, his titles, to Usyk, who is a Ukrainian boxer. And he had 2 bouts with him. And in the second bout in Saudi Arabia, he cried inconsolably. And segments of the media eviscerated him. They roasted him. Why are you crying? A man shouldn't cry. And so I received this award from, it's called Who Cares Wins. And it was a star-studded event. King Charles was there. The Prime Minister was there. And other celebrities were there. I don't know if I think the Spice Girls were quite big in the US. Yeah, the Spice Girls were there. yeah, Scary Spice was there. She was actually sat next to AJ, and she was actually very dignified. She's like, Professor Henkier, please sit next to the former heavyweight champion of the world. And she relinquished her, she let me sit in her chair, bless her. But the point is, when I delivered my acceptance speech, I quoted Marvin Gaye, and I said, Marvin Gaye, in the lyrics of the song, heard it through the grapevine, I know a man isn't supposed to cry. I was like, respectfully, Marvin Gaye, I disagree with you, because we need to rewrite the narrative on what it means to be a strong man, what it means to be a strong person, and expressing our emotions and seeking support. These are signs of strength, not signs of weakness. And that's when me and AJ made eye contact. I saw him in the audience, and I confessed my love to him. AJ, I love you. The bromance was like, it was like next level. And then somebody grabbed my arm. I don't know what was happening. And they took me to his table. And as you can see, I'm sat in his lap there. Talk about bromance, right? But yeah, like his arm was as big as my thigh. But that was a beautiful moment. A beautiful moment. So the health humanities has been defined as the application of art and literature to medicine. The application of art and literature to medicine. And this is how I connected with Corey. I remember in the Royal Society of Medicine, the International Symposium on Poetry and Medicine. And this is a book from Oliver Sacks, the late Oliver Sacks. And this is in the preface of his book. In order to restore the human subject at the center, the suffering, afflicted, fighting human subject, we have to deepen a case history into a narrative or tale. Now, Carl Jung used the term the wounded healer as an archetypal dynamic to describe a phenomenon that may take place in the relationship between analyst and analysand. Jung described the wounded healer archetype in relation to himself. He said, it is our own hurts that gives us our measure of our power to heal. It is our own hurts that gives us our measure of our power to heal. Now, the beauty of this is that it defies a single interpretation. But my interpretation, my humble interpretation, is that the deeper the wound, the more empathic a healer you can be. And these are some autobiographical narratives from wounded healers published in the New England Journal of Medicine. So there's Suicide Rewriting My Story from Justin Bullock, who I think is a nephrologist. He's currently doing his PhD, and he's a person of color, and he identifies as belonging to the LGBTQ+ community, and he's living with bipolar affective disorder. And this is another autobiographical narrative by Adam Hill, and I think he's a pediatric oncologist in Indiana, talking about his addiction to alcohol and the stigma attached to that. And this is my autobiographical narrative, which traces my recovery story. So in 2006, I was a medical student in Manchester in the UK. And I woke up one morning to discover that my hometown in Lebanon was bombed and that people were killed. And I feared that my family were among the dead. I couldn't get through to them. I reacted. I felt overwhelmed. I felt powerless. I was angry. I was so upset. I was so hurt. And I developed a mental health crisis. But debilitating though the symptoms were, the stigma was far, far worse. When I needed care and compassion the most, I received ridicule and rejection instead. And in my despair, I contemplated ending that which is most precious, human life itself, my life. But alhamdulillah Rabbil Alameen, as a practicing Muslim, suicide is forbidden in Islam. So that deterred me from acting upon these seductive suicidal impulses, and I chose life instead. Now, C.S. Myers in The Lancet said that everyone has a breaking point, weak or strong, cowardly or courageous. Everyone, war frightened everyone, witless. And in the immortal oratory of the Joker, insanity is much like gravity. All it takes is a little push. What about a full-blown war? This picture was taken in September 2024, and it was my khalu, my uncle, and this building is adjacent to my uncle's building. And unfortunately, the Israeli military, they dropped a bomb on this building and they killed all the inhabitants of this building, including Julia, our neighbor and our friend. Julia is a young lady. She was a master's student in France, and she returned to Lebanon because she was fearful for her family's safety. And Julia said that if my family die, I will die with them. And tragically, Julia was killed with her mother. Her father survived. I don't know what her father must be going through right now. But people ask me, and then unfortunately, my parents were forcibly displaced from the south because of the attacks. And I was having a WhatsApp video call with them because the Israeli military announced that they would be bombing the neighborhood that my parents were staying in. And so we were praying together. We were literally praying. We pray that the Israeli military doesn't bomb this building and that they don't kill us. And people ask me, was that triggering? I'm like, yeah, that was triggering. Of course it was triggering. It did trigger the resurfacing of traumatic memories of when I had a mental health crisis back in 2006. I want to be clear here, like I condemn the killing of all innocents. I condemn the killing of innocent Israeli civilians by Hamas and by Hezbollah, and I condemn the killing of innocent Lebanese and Palestinian babies, children, and civilians by the Israeli military. I condemn the killing of all innocents, irrespective of the background of the perpetrator or the background of the victim. I just want peace. Can't we just live peacefully together? I told you that recovery is also discovery, because not all of our friends on Facebook are our true friends. And I wouldn't recommend it, but a good way to test if you have a loyal friend or not is to have a mental health crisis or a psychotic episode or a manic episode or a depressive episode. I mean, I wouldn't recommend it, but I'm just saying that you discover who your true friends are, because those who love you are not fooled by mistakes you have made or by dark images you hold about yourself. They remember your beauty when you feel ugly, your wholeness when you are broken, your innocence when you feel guilty, and your purpose when you are confused. They will not judge you for that impulse. They will not judge you for how you behaved when you were not in control of your faculties, because they remember you when you were whole and not when you were broken. And I refuse to be judged by anyone based on my impulses. No mortal has the right to judge me. No mortal has the right to judge me. How dare you? And these are the tools that I personally utilized to cope with trauma. So for me, physical activity is non-negotiable. And there also has to be accountability as well. So I can't give you this keynote lecture and say, and rave about the benefits of physical activity. So that's what inspires me, the accountability. So, I went for a 15-kilometer run before I gave this presentation, even though I'm fasting. I went for a 15-kilometer run last night as well because of the accountability. And that contributes to my mental health resilience, and it contributed to my mental health recovery. The social connectivity. And we don't need, it's not the quantity of those social connections, it's the quality. We just need one high quality social connection. And tragically, far too many of us don't even have that one high quality social connection. Who do you think I'm providing care to at 2 o'clock in the morning in the emergency department in a mental health crisis? They are lonely, they are disconnected, they are isolated, they are stigmatized. And the creativity as well. We need to have that creative outlet. It could be spoken word poetry, it could be improvisation, it could be doodling, it could be singing or playing a musical instrument or painting or whatever. And spirituality and psychotherapy. So the Wounded Healer has been described as an innovative method of teaching that blends the power of the performing arts and storytelling with psychiatry. Because the argument I make is, how can you educate an audience if you can't engage them, if you can't entertain them? Because when you entertain them, that's when you engage them. And then when you engage them, that's when you can educate them. Because I was fed up of receiving these, let's be honest, boring lectures in medical school. They were so like soporific, right? And I was determined to deliver this message of hope and recovery. So I remember when I was invited to deliver the Wounded Healer to medical students at King's College London in the UK. It's a massive cohort, 350 students. The auditorium was packed. And there was a student sat in the front row. I'm not making this up. And for the life of me, I don't know why he was sat in the front row, because he was sleeping. And not only could you hear him snoring, you could see the saliva drooling down his face. I was like, if you're going to sleep, you might as well try to be discreet about it and sit in the back. But he was in the front row. And so then I delivered the Wounded Healer, and Corey will remember this. It's high energy. It's very theatrical. It's very dramatic. Basically, I reenact the scene from Pulp Fiction. Memories of Pulp Fiction haven't faded. That scene, Samuel L. Jackson, the path of the righteous man is beset on all sides by the inequities of the selfish and the tyranny of evil men. Blessed is he who, in the name of charity and goodwill, shepherds the weak through the valley of the darkness, for he is truly his brother's keeper and the finder of lost children. And I will strike down upon thee with great vengeance and furious anger those who attempt to poison and destroy my brother, and you will know that I am the Lord when I lay my vengeance upon thee. And the brother in the front row, he wakes up, and then he goes like this. And he stayed awake. And if Jules from Pulp Fiction does not galvanize audiences, I don't know what will. So that's the Wounded Healer. I reenact scenes from famous films to entertain and educate, and to entertain and engage, and then we can educate. And I also share my recovery, discovery journey. And so any anti-stigma intervention must be evidence-based and data-driven. And Stephanie Knack and colleagues at the University of Calgary They published this paper, Key Ingredients of Anti-Stigma Programs for Healthcare Providers. There are 6 key ingredients. My Wounded Healer presentation contained 4 key ingredients, but it was missing 2. So I took 3 years out of my residency, and we need top-down and bottom-up approaches to combating stigma. So what I did was I reached out to every single medical school in the UK, and every medical school has a psychiatry society, a psych soc. So this was a bottom-up approach. Nobody heard of me back then. Out of pocket, I was paying for this. And I delivered the Wounded Healer to every single medical school in the UK. But then I went global. I delivered it in person to 150,000 people in 25 countries worldwide. I was a man in a mission. I still am. This is the second iteration of the Wounded Healer program. It was a 2-hour event comprised of 3 EPPEs, 3 wounded healers from diverse and different ethnic, generational, and gender backgrounds. And one of the speakers is Professor Jamie Hacker-Hughes, who was the former president of the British Psychological Society, which is the counterpart organization of the American Psychological Association. And he's living with bipolar affective disorder. This second iteration had all 6 key ingredients. And then we collaborated with King's College London Psychiatry Society, or PsychSoc, which is the largest and oldest psychiatry society in the UK. And we recruited individuals who attended this event to participate in the study. It was a small sample size, but we had a 100% response rate. And basically, we administered the psychometric stigma scales. So this is the scale on knowledge. If you remember, stigma is an umbrella term comprised of 3 main components: problems of knowledge, problems of attitude, and problems of behavior. So the higher the score, the lower the stigma. So before exposure to the event, you can see on the left, it was 20, and then on the right, it was 22. There was a statistically significant reduction in stigma in the domain of knowledge, also in the domain of attitude, and also in the domain of behavior. And these p-values were really impressive. Basically, it was statistically significant. So this was the first ever intervention study published in the literature, comprised of wounded healers. This is an anti-stigma program comprised of wounded healers. And Stephanie Knack's 6 key ingredients for effective anti-stigma programs for healthcare professionals were all included. And as I said, the wounded healers were from diverse generational, cultural, and gender backgrounds. But it's encouraging. The results were encouraging, but it was fraught with limitations. Small sample size, no control group, no follow-up data, and 2 hours. Really? 2 hours? This is the digital age. So basically, talking about the digital age, this might betray my age. Remember Jerry Maguire? Yeah, that film. Yeah, Tom Cruise. You know, the heart throb that he is, right? Or is that what, I don't know. He walks into the room and he's like, "Where's my wife?" And I think he launches into a soliloquy and starts, like, I think they were having group therapy session, you know, why they all hate their husbands, kind of thing. And then he, like I said, he launches into this monologue, and she's like, "Shut up. You had me at hello." It's a terrible Renee Zellweger impersonation. But the point I'm making is, you've got to get them at hello. You've got to get them at hello. That's how narrow the window is for rejecting stigma, because our attention span has become fragmented. The digital age, social media. This is a fascinating study conducted by Doron Amsalem. This is a brief video intervention targeting the aim of which was to reject the stigma attached to first episode psychosis. I would say the most stigmatized conditions are psychosis and personality disorder, borderline personality disorder. And this was a randomized study. And by brief video intervention, I'm talking about it was 90 seconds. That's all it takes. A 90-second video, the protagonist of which was an African-American woman living with schizophrenia. And so there are processes There's the identification, because the protagonist experiences emotional turmoil, pathos, despair, sadness. All of us can identify with that. We can identify with the protagonist. But also there's that emotional engagement because she's sharing her story. So there's emotional engagement. There's also humanization as well. She's humanizing people living with a mental health condition. And it was associated with sustained reductions in stigma. That's all it took. It just took a 90-second video intervention, the protagonist of which is an African-American woman. We have the power to reject stigma, and we have to leverage the power of technology. And so we are in the process now of developing a brief video intervention, the protagonist of which is a medic, is a doctor, is a physician living with a mental health condition. Because if you remember, 400 doctors die by suicide every year in the US alone, and suicide is often driven by a mental illness. So we hypothesize that this brief video intervention will reject stigma, will break down the barriers to mental health care, and people who urgently need them can receive them. And of course, countering stigma starts off with the individual by challenging our own prejudices and preconceptions. And for those of you struggling with your mental health, I know the world can be a dark and lonely place. Believe me, I know. But don't give up hope. Don't give up hope, because recovery is a reality for the many and not for the few. Not for everyone. We're not doing enough for people living with a severe mental illness. And that's a scandal, to say the least. A society, a community, it's judged by, a government is judged by how we treat the most vulnerable in society. The government is judged by how we treat the most vulnerable in society. And if you look at how people living with severe mental illness are being treated, then we have failed spectacularly. So I'm not going to stand here and say everyone recovers. No, not everyone recovers. And that's tragic, to say the least. But recovery is a reality for the many and not for the few. And if I can recover and realize my dreams, and there I was. This was in Geneva, in Switzerland, and that's Dr. Tedros, the Director General of the World Health Organization. It was the proudest moment of my life. And if you told me when I was in the grip of the mental health crisis back in 2006, that I would receive this honor, that I would speak to world leaders and receive a standing ovation, I would never have believed you. I would never have believed you if you told me back then. So don't give up hope. Choose life. Because if I can recover and realize my dreams, other people living with a mental health condition can recover with the right support. With the right support, they can recover and realize their dreams too. Thank you so much.
Thank you so much, Dr. Hankier. We have just lots of hearts. I hope you can see all of the hearts coming up in the.
Yeah, I love hearts. Hearts and
And
hugs.
so, yes. So for those of you watching tonight, Professor Hankier is actually here in the NAMI New Hampshire office and speaking to a group of staff and volunteers and friends. We also have 2 watch parties. So we have a couple of things in the Q&A that I'd like to share. One is a little bit long, but I'll read it to you, and then she does have a follow-up question. So I do see some brightness on the horizon for healthcare professionals. The suicide of Lorena Breen, the ER physician, I believe at Langone Hospital in New York City, resulted in her family, notably her brother-in-law, succeeded in advocating for changes. Though I don't know the specifics of the data states, it is now possible for medical students and physicians to seek mental health care without jeopardizing their degrees, licenses, or promotion. One of the positive outcomes of the pandemic. Another, in the US, physicians organized free support phone, Zoom-like support at no cost. Despite these terrifying times on so many levels, I believe there is indeed hope. Thank you for your keynote. I've been on board with your philosophies and views for as long as I can remember. The other hopeful trend I observed during the early days of the opioid overdose crisis was the encouragement of those in recovery to come out of anonymity to serve as peer supports. The growth of peer support and its legitimization. So she has one thought slash question for you. Do you believe that the wounded healer needs to do their own work before being effective as a healer?
Oh my goodness. What a question, huh? What does the person who asked the question think? And then I'll answer.
Oh, well, we can wait to see if they'll put it in another follow-up. So that was from Nancy.
Nancy, what do you think, Nancy? Thank you for asking that question. It's an important question.
Well, we wait for her to type. We have another question
Mm.
from one of our volunteers, our newer volunteers. Says, thank you. And what is your opinion of why mental illness stigma exists? Are
Yes.
people afraid of mentally ill people or something else?
Yeah, I think we are afraid of what we don't understand, right? And I think it's like it's the other, isn't it? Like, I mean, stigma, we can trace it's since antiquity, isn't it? As I mentioned, you know, the example of the ancient Greek criminals and traitors, and that's where the term comes from, and how they were treated, and back then how people living with a mental health condition were treated. I mean, they would find their skulls, and they thought they may have been possessed by some kind of malevolent entity or something, or all kinds of witchcraft. But to answer the question, so as I said, I think we're afraid of what we don't understand, and there are a lot of myths about people who live with a mental health condition. For example, we have a proclivity to be violent, but the reality is that we are more likely to be the victims of violence as opposed to the perpetrators of violence. And also, I mean, sensational coverage, irresponsible reporting by the media. For example, the language that we use, the terms that we use to describe people living with a mental health condition. So I think it can stem from ignorance, but also, as I mentioned, the kind of the prejudice and the discrimination as well. So yeah, there are multiple reasons why stigma exists. For example, with the physicians and the physician bias. So a psychiatrist is more likely to see a patient in extremis when the patient is floridly psychotic, for example, and if they are hallucinating and if they are vocalizing paranoid delusions, the psychiatrist may think that they will never recover and the treatment will never be effective. And so that contributes to stigma, I guess, exposure to when people are extremely unwell, but that's like just a snapshot. So also, I think maybe because you were not aware, you may not have met a person, or you might not be aware that you are working with someone who is living with a mental health condition, or that a friend of yours has a mental health condition. And so when that person reveals to you that they do have a mental health condition, then that might help to lower the stigma. I hope that answers your question. Hence why sharing is so powerful. That's how we combat stigma, by making contact, that social contact, that face-to-face contact, or even that virtual contact as well. So I think it usually stems from ignorance, prejudice, and discrimination, misinformation, myths.
So the volunteer that asked that question is newly trained in one of our programs called In Our Own Voice, where we train individuals to share their story. So thank you for that question. Nancy followed up. She said, yes, I absolutely do. Of course, this is ongoing. So back, she said, do you believe that the wounded healer needs to do their own work before being effective as a healer?
For me, it's an emphatic yes. And I think that's why therapy is not only important, but absolutely necessary. Because you might be familiar with Sigmund Freud and the different models of the mind. And I often explain this to my students and my patients. And you have the structural model of the mind, you have the topographical model of the mind. So the structural model of the mind, you have the ego and the superego and the id. and the topographical model of the mind. Think of the iceberg, and you have the conscious and the unconscious and the pre-conscious. And the conscious mind is like the tip of the iceberg, right? But what is submerged beneath water level is the bulk of it's the unconscious. Like, so much is happening in the unconscious mind. All that trauma, all the distressing memories and emotions and unresolved trauma, we just bury it into the unconscious mind. And even though we're not aware of it, it continues to influence our mental health, our functioning, and our interpersonal relationships. And we talk about unconscious bias training. What about unconscious ego training? I mean, how much interpersonal relationships, romantic relationships, marriages, friendships, relationships with our colleagues at work are destroyed because of the ego, right? So I think absolutely, there's a lot of work that we have to do. You have to process that unresolved trauma, because you don't want to bring that with you, especially in a therapeutic setting. Absolutely not. You want to be that, in a way, a tabula rasa, a blank slate. You don't want to project. And I think there's a lot of projection that obviously can be problematic, especially in the context of therapy. So an emphatic yes. And that's why I'm a huge fan of therapy, because there's so much, adverse childhood experiences. Let's talk about family dynamics. One of the questions I ask my patients, and I don't think every psychiatrist asks their patients this question, and they should, was there any favoritism? Did a sibling receive preferential treatment? How did that make you feel? How was that influencing your interpersonal relationships and your vulnerability? What are your blind spots? Why is it that you became trauma bonded to this narcissist? Why didn't you see the red flags? So, we need to process all that unresolved trauma to identify these blind spots and these vulnerabilities. And hopefully that will improve our mental health and our functioning and our interpersonal relationships.
Great, thank you so much for that. We do have a comment from Heather, who is a very strong volunteer and advocate here in the state of New Hampshire. She said, I'm glad you mentioned perinatal mental health. Thank you.
You're welcome. You're welcome, Heather. We actually did a study on that, actually. Yeah, the stigma attached to mental health problems in the postpartum period. That was an interesting study, because we invited an obstetrician and a mother, and she spoke about her experiences with postpartum psychoses, and it was really powerful. And again, it was effective at rejecting stigma.
So that's all we have in here for right now. I don't know if anybody in the conference room there has any questions they want to ask, or if you have any other final words before we wrap up.
Oh, the final words, it's very simple, isn't it? Like, in a world where we can be anything, be kind. Each of us are fighting battles others have absolutely no idea about. The mask of mental health can be so misleading, if not deceiving, right? The mask of mental health is misleading, if not deceiving. So on the surface, when someone asks you, when you ask someone, how are they? The automatic response is, I'm fine. Really? Are you really fine? Because the reality is, like I said, many of us are fighting battles others have absolutely no idea about. So in a world where we can be anything, be kind. Don't be the hand that pushes someone over the edge. Don't be the hand that pushes someone over the edge. Be the hand that reaches out to rescue them. We have a choice. That's my take-home message. And never give up hope.
Never give up hope. It's a beautiful message.
Cultivating hope, isn't it?
Ties in. Right.
Cultivating
Yes.
hope. Plant the seeds of hope. Plant the seeds of hope into the hearts, minds, bodies, and souls of people living with a mental health condition.
Can I ask a question?
Of course you can, Corey.
It's a question and a comment. First of all, thank you. It was an incredibly insightful, as I expected, presentation.
Appreciate that.
When I think about stigma, I consider it categorized under the rubric of bias.
Yeah.
I feel that it's a form of bias.
Yeah.
And as such, you mentioned that you went and lectured all over globally.
I did.
And you touched, I'm sure, a lot of minds.
I hope so, and hearts as well.
But the work, particularly in the educational world, if we're trying to educate healers and physicians and practitioners, it's ongoing.
Oh.
It's not just, oh, Dr. Birchman, here, you're gonna have bias training for 2 hours in September, and then you're good.
Yeah,
You know, I mean, that's sort of what I got out of institutional medicine. And clearly, we all understand, obviously, because I'm speaking to people who are in the pit. It's not a one-off.
oh God, no.
It's a practice that has to be continuously imbued in your routine and your fiber.
Yeah, absolutely. I couldn't agree more with you.
I just feel that institutional medicine, from which I was raised, doesn't get that,
No, it doesn't.
and that's problematic.
Absolutely, absolutely. And usually the resistance that I face from institutional medicine, especially institutional psychiatry, is fierce. But we can't give up because things can't continue the way they are. Every suicide, as I said, is a tragedy. And in the case of physicians dying by suicide, 400 per year, we can't continue. Things have to change. And we will be agents of that change. Thank you, Corey.
So thank you again.
Oh, I have
somebody said-
one more question here.
Great.
So,
When we're talking about health, we divide it, sort of at the neck, right? It's mental health and it's physical health.
yeah.
Do you think it would benefit us to remove that line and just refer to it as health? Get rid of the delineation?
What do you think?
I do, I absolutely do, and I do some education here at NAMI New Hampshire. And I have my own health condition,
Yeah.
which is depression.
Yes.
And I say, I have a health condition. I'm not gonna call it a mental health condition.
Yeah.
I have a health condition.
Absolutely. Well, I mean, there's no health without mental health, right? So,
Right.
and yeah, I mean, I agree with you. I actually, I like the sound of that. It's a health condition. And unfortunately, you know, we need to be holistic. And unfortunately, is it that dualism, isn't it? Was it Descartes, you know, like the mind and the body, and we operate in different silos. And I just don't find that helpful at all, because they're so kind of deeply interdependent, aren't they? Like your mental health. If your mental health deteriorates, so too does your physical health. And if your physical health deteriorates, so too does your mental health, right? So I agree with you. You know, I treating them as if they are two distinct entities, I don't think that's helpful. I think that's unhelpful, actually, and it's problematic. So that's an emphatic yes from me. You're welcome. Thank you for asking that question.
See, so a few more things came in.
Hmm.
We have another thank you from our board president. This is important and inspiring work.
Very welcome.
Mary says, I had an incredible opportunity to speak openly with residents at Dartmouth-Hitchcock Medical Center after giving birth for the second time about my experiences with postpartum psychosis after my first childbirth. It felt so important to be educating the yet-to-be doctor. And she continues, as a woman speaking about symptoms I experienced to a man who would never experience the same symptoms, it was empowering to be reaching out to ask for treatment to start before my mental health got as bad as it did after my first childbirth.
Sorry.
So just really good comments. Somebody says, very sad. I had such a hard time finding a correct congratulations on my father's recovery journey. The stigma is so real in so many ways.
It is. I mean, we've made progress, but there's still a lot of work to be done, for sure.
Yes. Okay. Oh, good. I see. You got your drinks.
Sorry, I'm breaking my fast.
Yeah. Nope, it's past sunset. We're good. So it looks like they come in after I close it. Thank you for sharing your passion regarding this topic. More thank yous and wonderful presentations.
Oh, you're very welcome. Thank you for saying that, because I do face resistance, especially from certain psychiatrists, not all psychiatrists, but there are some psychiatrists who have been very vitriolic towards me. So when I get this positive feedback, it strengthens me and it inspires me to continue fighting that good fight. So I really appreciate it. Thank you so much.
So we thank you. Okay, so I'm just going
wrap.
to, yep, that's a wrap. Thank you so much.
Pleasure. Thank you for
Lots and lots of loves and claps. All right, let me just share my screen one more time. All right. So thank you, everyone, for joining tonight's keynote presentation. Join us tomorrow morning at 9 a.m. for the welcome session and opening remarks from our Executive Director, Susan Stearns, and from Lori Weaver, Commissioner of New Hampshire Department of Health and Human Services. Please be sure to review all the amazing sessions we've prepared for you tomorrow, including our afternoon keynote presenter, Kim LaMontagne, and a short presentation from New Hampshire Governor Kelly Ayotte. We had a new opportunity for staff, volunteers, and community members to engage and gather in person to watch tonight's keynote presentation. So as I said, we had a few here in the office, but we had one out in Keene and one out in Londonderry. So I'd like to send a shout out to our two dedicated volunteers, Cynthia Green in Londonderry and Sharon Stout in Keene, for hosting watch parties this evening. We are also offering a new opportunity this year during the lunch hour tomorrow for our virtual expo area. It will be open for short presentations in a more casual setting. They will be Zoom meetings instead of a Zoom webinar. Be sure to check those out. And we'll explain tomorrow how to get into them a little bit easier. And we also have in the lobby for the conference, we have a conference program this year, which is really exciting for you to download, as well as some quick user guide, which will help you get into that expo as well. Please keep an eye out for an evaluation that will be mailed to you at the end of the conference. We appreciate your feedback on this session and the conference as a whole. If you need a certificate, you will be able to download one after completing the survey. A recording of this session and all of the sessions will be available in the conference lobby later this week, and then also on the NAMI New Hampshire website and YouTube channel. So thank you all from everybody here, and we will see you tomorrow morning at 9 a.m.